Hi, today we're going to talk about something that has to do with an aging process and the life of the ladies. In reality, when you look what happens to a lady that is about 70, 75-year old, there are three things that are happening. Number one, ladies have more heart disease after 75 than men. Ladies have more osteoporosis than men, and ladies suffer more dementia. So these three things, even though they look like disconnected between each other, have to do with the aging process women go through. So today we're going to talk about what menopause is and how to treat. Menopause is the end of the menstrual period in a woman. It means that the end of the reproductive life. Your ovaries that have been producing estrogens for too long, since the first time when you were 13 or 14, simply went through a process of atrophy, and they are no longer producing the estrogens you need to maintain your tissues. Menopause, which is the name of this phenomenon, is produced between 38 and 55 years old in the woman. At that time, there are many things that happen. One of them is that because of the estrogens are less, you lose the protection that the estrogens provide to the heart. That's the reason why women may have more heart problems than men in an elderly step. And then the metabolism of calcium will decrease, and you will have more osteoporosis, the calcification of your bones. And then the dementia has to do with certain hormones that you produce that will activate your brain. So menopause is a sharp decline in the production of these hormones and in general of your lifestyle. Everybody has heard or has experienced after menopause the presence of hot flashes, irritability, insomnia, memory problems. Your memory is not that sharp now, and many people refers to these problems as foggy brain. The skin and the mucosas, especially in the vagina, gets dry, and that produces problems in sexual activity and so on and so forth. So the intent to replace the hormones your ovaries are not able to produce for you has been something that has been a matter of controversy in the last 25 years. Some misdesigned and misinterpreted studies demonstrated in the past that hormones could produce cancer to the breast or to the uterus. But further examination and evaluation of those studies have demonstrated that only hormones that are not natural may increase the possibility of cancer. Of course, there are some people that may be predisposed to cancer of the breast and uterus, but certainly hormones that are coming from some animals, for instance, increase the risk a big time. So the treatment that is used at this time for this is in the form of bioidentical hormonal replacement. And it means that we use hormones that are coming from natural products. The majority are coming from sweet potato or from yams, and are exactly identical to the hormones that you used to produce. Hormones meaning estrogens. So these hormones can be administered in two forms. The number one is through creams, for instance, transdermal. Don't ever use estrogens by mouth, because your liver will transform them into an estrogen called estrone that is highly uh, carcinogenic. So we use estrogens that are in a way protective from cancer, and in the form of a transdermal cream. So the creams are bringing estrogens in different forms and are absorbed through your skin and produce the benefits that every young woman is experiencing as a natural way. The other way to do the bioidentical hormonal replacement is through pellets. It's hormonal implants. In other words, the estrogens are compressed into a very small uh, size, kind of the rice, the size of the rice, and those are placed in the fatty tissue, in the subcutaneous tissue. This form, the estrogens are released constantly, and the effects last approximately 5 months. In any way, this is complemented by the addition of progesterone, which is the hormone that counterbalances the effect of the estrogens. In expert hands, all these processes and treatments are very safe and at the same time produce mainly benefits in the ladies. In the 21st century that we're going through, and maybe after the second half, we will have this as a routine in women to make them more productive, more active, and have a better life. If you would like a better information about this or more information about that, just call the Institute of Regenerative Medicine at 915-490-0647. Thank you.